Are you somebody that struggles with hip pain, or maybe you feel like lately your hip just doesn't move the way it used to, or maybe as you walk, you feel like your gait is off, that hip moves around, or when you're doing your daily activities around the house, one hip just feels different than the other, and it wasn't like that before, and you're not real sure what's going on. If that sounds familiar, I'm going to give you some helpful tips today. So pay attention to this video. Hey, I'm Dr. Putney with Wellington Family Chiropractic. And today I'm going to talk about hip internal rotation. It's something I find lacking on a lot of my patients. That causes problems with the way they move, they squat, they walk. But it also, I find that the muscles that internally rotate the hip on a lot of my patients are weak. So I'm going to show you what that looks like when they're weak and how we assess that, and then give you just an easy exercise you can do at home to start working on the strength of the muscles for internal rotation, which should help improve your range of motion that can be lacking, but also improve the stability of your hip and the movement of your hip, and improve the strength of the muscles that are responsible for that internal rotation. So when we talk about hip internal rotation, what in the heck are we talking about? Well, when we look at most people, internal rotation can be lacking whenever we do this. So this would be internally rotating my hip, which it looks like my foot is going out, so you'd think it's externally rotating. This would be external rotation. This is internally rotating my hip. And when I assess that on patients in supine or laying on their back, when I'm looking at maybe working up their low back or trying to figure out what's going on for their hips, you'll notice when I put them into that internal rotation, it's lacking. Now, other people, I'll have them show me what they've got and they can't move it much, but then when we lay them down, I can just passively work it into range of motion. So there's a difference between them being able to do it and then when they're on the table, me being able to passively range them or move them through a full range of motion. When I see that, I know the muscles in that take that hip through that range of motion have gotten weak. And so there's a really good exercise you can do for it. I'm going to show you with a foam roller today. You don't have to have a foam roller, but it does help kind of rest your knee. What you're going to do is you'll just lie on your side, and the hip that you're going to be working on range of motion wise will be the one on top. So you just lay on your side, get comfortable, and then you're going to work to internally rotate the hip. And so what you're going to do, let me get my foam roller correct, is you're going to be in this position. Now this keeps your pelvis neutral. If you don't have a foam roller at home, you can use something else. It's just something to create some space between your knees is typically what I'll have patients do. And then holding the foam roller still, that patient just internally rotates the hip. So we're going through that range of motion I just talked about, but I'm doing it on my own. Now I'm working to keep my low back, torso, everything else still. We're just isolating right here. So it's not a, I'm not compensating and moving the rest of my body. Everything stays still except the hip. And my knees are bent, and I'm just bringing that foot as high as I can straight above the foam roller. You will feel a lot of these little muscles around the hip really working to do that. And you can check this on both sides, and a lot of times you'll notice that one side has gotten much weaker than the other. So what you can do is do 3 sets of 10 of this exercise here. It doesn't look like much, but if you do it, 3 sets of 10 is quite a bit. But if you're somebody that's working on progressing this exercise, put a band around the other ankle and loop that around both your ankles to where you now have resistance going up. And if you do this and progress through that and begin to add resistance, you can strengthen those muscles that internally rotate the hip, and it helps to balance your gait. It'll help improve your range of motion and give your hip more stability throughout the day. So if you're somebody that wonders sometimes if something's going on with your hip, maybe lay on your back and just try to internally rotate your hip. You can do it in standing like what I just showed you. You will notice on some of you that it's way worse on one side or the other. If that's the case, get you something between your knees, lay on your side, and give this exercise a chance. It's a really good one. It's something anybody can do, and it benefits almost everybody. So a hip internal rotation exercise, improve your gait, improve your hip mobility, make that thing feel better. I hope this helps, and I'll talk to you soon.